Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will look into one of the important topics, that is HIV or AIDS. We will look in depth into it today. The main problem or the challenge faced by the people is, as soon as they come to know they are HIV positive, they get panic. Because of that, they land into a lot of stress. Because of this stress, they don't take proper diet, they don't exercise properly, they don't sleep properly. Because of all these things, there is stress is at highest levels in their body. Because of this stress, their immunity will come down, and rather than delaying the HIV or AIDS stage, going into AIDS stage after a long time, they will quickly go into AIDS stage. So that's the reason initially you should not get panic and you should not be decreasing your immunity. And the next common problem we face with the patients is, there are a lot of fake homeopathy doctors or Ayurveda doctors, Unani, Siddha doctors, even allopathic doctors. There are lot of fake doctors. They say that they can cure the HIV completely, and they will show in the reports as well. When you take the viral load, it will come to normal as well. They can show you zero viral load. These viral load tests are done on blood, not in other tissues. For example, breast milk or any other fluid. So if the viral load in blood is zero, it doesn't mean it is also zero in other fluids of the body. You have to understand, once the virus enters into your body and the viral DNA or the viral pro DNA integrates with the human DNA, there are no already existing medicines or the medicines in clinical trials which can detach this viral pro DNA from the human body and throw it away. So once you get the AIDS or HIV integrated into your body, it is highly impossible or it cannot be cured. So with the treatment, as long as you take the treatment, the virus will not be multiplying, but still you have the viral DNA. As the viral DNA is low, you should not be thinking that it is completely cured and you should not stop the treatment. We have seen in many cases where they go to a quack doctor, they see in the reports that the viral load is zero and they think that they have cured of HIV. There is no cure for HIV, and they land into HIV again. Once they stop taking the treatment, the viral will multiply again and they will be landing into lot of issues that we have seen with many of the patients. Do not believe if anyone says they can cure the HIV completely. And the next one is, when do people come to homeopathy? People come to homeopathy even after they take ART, their CD4 count is not increasing, or they come to homeopathy even after taking ART, their viral load is not coming down, or else they have severe side effects because of ART treatment, and they are landing into lot of serious symptoms even after they are taking ART treatment. So in these conditions, patient comes to us. Even other patients, when they want to improve the quantity of life or longevity and they want to improve the quality of life, they come to homeopathy. When you take homeopathy along with ART treatment, your both quality and quantity of life will be increased. The intensity of the symptoms, the duration of the symptoms and frequency of the symptoms will be completely decreased. With proper homeopathic treatment and few lifestyle modifications, you can prolong the second stage of HIV. You can postpone landing into AIDS stage. When you take homeopathic treatment, you can live the normal life as other normal person. So you will be living as many years as the other person lives. The only difference between you and the normal person is you will be taking the treatment and the normal person will not be taking the treatment. Other than that, everything remains same. You can live as healthy as normal person and you can live as long as normal person with homeopathic treatment. Now we will look into what is HIV. HIV is a disease that attacks your immune system. So basically in human being there are 5 types of immunity. These immunity are broadly divided into 2 categories. One is innate immunity and acquired immunity. So innate immunity, in the sense you are born with this kind of immunity. Acquired immunity means over a period of time, when you grow, when you expose to different pathogens, you will get that immunity. So basically immunity is categorized into innate immunity and acquired immunity. Again, innate immunity is of 3 types. First one is barrier immunity. Barrier immunity is like your skin, your mucous membrane, which protects you from getting the pathogens into your body. The next one is cellular immunity. This cellular immunity also helps in protecting your body. Next one is complementary system. It is a special type of immune system which is present in your body. All these comes under innate immunity. And coming to acquired immunity, there are 2 types. One is humoral immunity, next one is cell mediated immunity. Humoral immunity takes care when the pathogen is in your blood. Once the pathogen enters into your cell or human cell, the cell mediated immunity will be attacking it and killing it. So HIV is the most powerful virus which will attack the best of your immunity. See, out of all these immunity, cell mediated immunity is the top immunity. It is the best immunity a human being can have. What this HIV virus is going to do is, it is going to kill the immunity that is the best immunity, that is cell mediated immunity, or acquired cell mediated immunity is hampered when you have HIV. Because of this, you will be landing into other disorders, other infections. These we call as opportunistic infections. So HIV will reduce your immunity. When the immunity is reduced, you get other diseases, other serious complications, and this will kill a person. That's what HIV is going to do in your body. Then coming to signs and symptoms of HIV and AIDS. Basically, AIDS is divided into three stages. In these three stages, you will be having different types of symptoms. First one is acute HIV infection. Second one is chronic HIV infection, and third stage is AIDS. So first stage, that is acute HIV infection, lasts from 2 weeks to 4 weeks. Chronic infection lasts from 1 month to about 10 years. After 10 years, we will be landing into AIDS. These three stages will have three different symptoms. So we will be looking into the symptoms of each and every stage. First stage, what will have? You will have within 2 weeks to 4 weeks, you will have fever, you can have chills, you can have sore throat, you can have muscle pains, or you will get sweats at night, you will get rashes. Sometimes your lymph nodes are swollen, maybe your inguinal or other lymph nodes are swollen sometimes. You will get ulcers in mouth, you will have cough, you will have cold, you will have body pains, some kind of weakness in your body, some vomiting sensation or vomiting you will have, nausea, running nose you will have sometimes, and nasopharyngeal irritation. Or these are all the symptoms that you can see in the first stage of HIV, that is acute HIV infection. In second stage, that is chronic HIV infection. So most of the people will not have any signs and symptoms here. Only some people have some signs, that is they will be enlarged swelling of their lymph nodes. Other than that, in second stage, there will not be any signs and symptoms. And coming to the third stage, that is HIV, you see lot of symptoms here. This is a full-blown AIDS when you have opportunistic infections. Along with the opportunistic infections, you will have some secondary neoplasias or cancers, and also neurological symptoms are seen in third stage of HIV or AIDS. At this stage, you can have uncontrolled fever, you can have uncontrolled diarrhea or respiratory infections, you may have severe weight loss and other problems as well. And coming to the opportunistic infections, oral candidiasis, where you get fungus in your mouth, or heavy leukoplakia, and also molluscum contagiosum. It is one of the diseases you will find in full-blown AIDS. And also you may land into tuberculosis, herpes simplex, human papilloma virus. Lot of viral diseases and bacterial disease may infest. And coming to the neoplasms, Kaposi's sarcoma is one of the common diseases you can see. And coming to the neurological symptoms, there are peripheral neuropathy. Peripheral neuropathy means you will get tingling sensation, burning sensation, entire your body, cognitive impairment, where your thinking is lost, your judgment is lost, and also meningitis and encephalitis, where you have inflammation of the brain, infection of the brain, and also inflammation of the layers that is covering the brain or spinal cord. You will have dementia. Dementia means you will not be able to remember anything, and also you will have increased risk for neurosyphilis. So it is a kind of neurological disorder. One of the serious complications of syphilis is neurosyphilis. You are at the high risk of that disease as well when you are in HIV. These are all the signs and symptoms of HIV. Now we will look into the investigations that you have to do for HIV or AIDS. Lot of people have multiple questions on this. We will address each and everything. So there are a lot of tests that you can do for HIV. PCR, antibody test, antigen test, ELISA test, Western blot test. There are a lot of tests. Every day new test is coming, but the basic principle is same. There are three things you can identify to detect HIV. One is viral RNA. You can detect the RNA of the virus in the blood of the person, or you can detect the antigen, especially P24 capsid protein. This is one of the proteins that is present in the nucleus of HIV. And also next one is antibody. When your body reacts against the antigen, antibodies are produced in your blood. Any HIV test you take, you will be detecting either viral RNA or antigen or antibody. So what is the sensitivity when you can detect this virus or antibody or antigen in the blood of a person? The most sensitive test is detecting the viral RNA. In about 50% of the cases, for example, if 100 people are infected by HIV, in that 50% of the people, HIV RNA can be detected from 15 days to 10 days. So in about 99% of the people, it can be detected after 30 days. So if you are doing PCR test or viral RNA test, it should be done after 10 to 15 days. It will be positive in 50% of the cases. In almost 99% of the cases, it will be positive after 30 days of infection. And coming to antigen detection, antigen here is P24 capsid protein. This protein in 50% of the patients after exposing to HIV can be detected after 15 to 20 days. After 45 days, it can be detected in 99% of the cases. And coming to HIV antibody, in 50% of the cases or 50% of the patients after exposing to HIV, this can be detected after 20 days to 30 days. In 99% of the cases, it can be detected after 90 days. That's the reason, depend on your stage, depend on your economic status, you should be doing all these tests, but you have to understand which test you have to do at what stage and what is the sensitivity. With this you will understand what type of HIV test has to be done at what stage of the disease, at what duration of the disease. This is very important for you. And when you are a HIV patient, you have been suffering from HIV, so at what time you have to do the viral load test. Viral load test has to be done every 3 months or 6 months. It will detect the virus in your blood. Even though the virus in your blood is 0, when the viral copies falls below 40 to 70 per ml of blood, it cannot be detected. You should not be considering this as HIV is completely cured, because the viral load test will be done for the virus in the blood. There is high chance that you will have virus in your blood or in your semen or in the breast milk. We are not checking for those places. We are checking the viral load only in the blood. It has to be done every 3 months and 6 months. And coming to the CD4 count, CD4 count has to be done every 3 to 6 months. When the CD4 count is below 200, it means you are at higher risk of getting any infectious diseases, and it is danger zone. If your CD4 count is above 450, it can be considered that you are in safe place. So always ensure that your CD4 count is above 450 and it should never come down below 200. These are all the tests you have to do on a regular basis or one time basis for HIV. This video is very important for the patients who are suffering from HIV, because everyone says CD4 count. So what exactly mean by CD4 count? What is that CD4 actually? See, basically there are three main receptors. Receptor is a protein that is present on human cell. In every human cell there will be a protein. These proteins are called receptors. These receptors are very important for normal physiological function. Each receptor will have a specific function in the human body. In the same way, in HIV there are three receptors that are very important. First one is CD4 is a receptor, basically that is a protein, and also CCR5 is a receptor, and also CHCR4 is also a receptor. So these are the receptors that are present in every human being, and these receptors are specific function in human being. What HIV does is, it makes use of these receptors which are designed for a specific function, and this HIV virus enters into the human body, human cell, by using these receptors. Basically it is like a parasite. The important things which are present in our body, the HIV virus makes advantage of it, sticks to it and enters into the human body. There are some specific type of cells on which CD4 receptors are present. CD4 receptors are present in T helper cells. Basically these receptors are present in our immune cells. HIV virus takes advantage of these receptors and enters into the human cells that are protecting our body. First one is CD4 receptors. CD4 receptors are present in T helper cells, monocytes, macrophages, dendritic cells and microglia. These are all different immune cells present in your body. In the same way, CCR5 is present in monocytes, macrophages and dendritic cells. The next one is CXCR4. This is present in T helper cells. So these are all the basic proteins which are essential for our body. This HIV gains entry into our body by sticking to these receptors. Coming to reasons for HIV infection. HIV infection is due to transfer of HIV virus from infected person to other person. What are all the modes of transmission? So this can be due to unprotected sex. When you are not using condom and having sex with the HIV patient, you will have this in your body. Next one is blood transfusion. When you get the blood transfused, when you are taking the blood from other person, that blood has to be checked for HIV, otherwise you will get HIV. Next one is exchange of body fluids. Body fluids, like any of the body fluids, you are exchanging semen with some other person, or saliva sometimes, or breast milk. These are all the body fluids that contain HIV virus. Next one is needles. If you are exchanging the needles, especially these needles are exchanged while taking drugs or surgical material. When you go to a hospital, you have to go to a good hospital where all the equipment is sterilized, and during surgery only sterilized material is used, otherwise you will get HIV. Next one is transplant. When you get a transplant, kidney transplant, liver transplant, you have to be very careful and check whether the person who is donating the organs is having HIV or not. Next one is vaginal delivery. When the mother is HIV positive and the mother goes for vaginal delivery rather than cesarean delivery, high chance that baby gets HIV in that process. And also breastfeeding. HIV is highly loaded in the breast milk. That's the reason when the mother is HIV positive, she should try to avoid giving breast milk to the baby. These are all the modes of transmission of HIV virus. Now we look into the pathology of HIV virus. What exactly virus does after entering into your body? After the HIV virus enters into your blood, this HIV virus contains a protein that is known as GP160. This GP160 protein again made up of two parts. One is GP120 and GP41. See, basically these are the proteins that stick with the CD4 cells or the CD4 receptors. GP120 surface protein, which is present on the HIV virus, will stick to the CD4 receptor. After sticking to the CD4 receptor, it will extend its arms. It will stick to the other receptors of CD4 cells as well. Once the HIV virus attaches to the human cell, the parts within the HIV virus are released into the human cell. Basically, these are RNA. There are two RNA or the dimer of RNA that will be entering into the human cell. Once it enters into the human cell, this RNA, what it does is, it will convert itself into DNA. This is called reverse transcriptase. By the process of reverse transcription, new DNA is created. This we call as proviral DNA. This will be double stranded DNA. This double stranded DNA will enter into the nucleus of the human cell. Once it enter into the nucleus of the human cell, it will cut the human DNA into two pieces. After cutting the DNA, this proviral DNA will attach its both end to the human DNA. Once this viral DNA is attached to the human DNA, there is no chance that it will detach from it again and you will be HIV free. This is one time process. Once the viral pro DNA is attached to the human DNA, it cannot be separated again. So whenever the gene is expressed, what happens is, from this proviral DNA, new viral RNA comes, and the viral RNA along with the other proteins, it will create new HIV virus from the human cells. So whenever this proviral DNA is expressed, it will create new viral RNA. This viral RNA along with other genetic material and important proteins will be converted into new HIV virus. This new HIV virus will attack other body cells. In this way, HIV virus will spread into other cells of human body as well. Once this virus spreads to all CD4 cells, it will destroy the CD4 cells. So the CD4 count is decreased. As the CD4 cells are the important cells for human immunity, as these decrease, you will be landing into lot of opportunistic infections. This is how HIV virus reduces your immunity, and it will make you more prone for the infective disorders. And coming to the conventional treatment, what is conventional treatment? Conventional treatment, also known as English medicine or Western medicine, this is a treatment you take from a sexologist or a corporate hospital. So what kind of advantages and disadvantages you have in conventional treatment? In conventional treatment, you are able to curtail the amount of viral load, but the problem is it is full of side effects. There are different class of antiretroviral drugs, or we call it as antiretroviral treatment. There are different kinds of drugs which will attack and reduce the viral load or the replication of virus, or it will curtail the virus at different physiological process or different stages of the viral life cycle. But it has a lot of side effects. First one is nausea. You will get vomiting sensation. Sometimes you get vomiting. You have fatigue. Fatigue means you will be having lot of weakness. Anemia. Some viral antiviral drugs will reduce the RBC in your blood. And also peripheral neuropathy. Peripheral neuropathy means you will get lot of pain and numbness on your limbs. You may sometimes get rashes, or it may sometimes damage the liver as well. And also some central nervous system symptoms such as dizziness, headache, trouble in sleeping, or gastrointestinal issues. Your gastric mucosa may be damaged, or sometimes you may have lipid abnormalities. You will have more cholesterol in your body, or less cholesterol, or less or elevated triglycerides. You will have headaches sometimes, insomnia where there is lack of sleep. You will have nausea, so you will have reaction at the injected site, or you will have upper respiratory tract infections, cough, cold. You may land into lot of side effects by using antiretroviral therapy. So the retroviral therapy is good, but it has lot of side effects, and you have to consider these side effects while taking the treatment. The only thing you have to remember is there is no permanent cure for AIDS or HIV. If someone says we will cure your HIV completely, do not believe them. Once the proviral DNA is integrated into your human body DNA, there is no drug which is in clinical trials or already in the market that can detach the viral pro DNA from human DNA and make you free of virus. Never believe these concepts. You can only reduce the viral load by taking regular ART treatment, antiretroviral treatment. Now we will look into how homeopathy can help you if you have HIV. If you have HIV, along with ART treatment, if you take homeopathy treatment, your lifespan will be increased, your quality of life will be increased. When you have symptoms, the intensity of the symptoms will be low, the frequency of the symptoms will be low, and the duration of the symptoms will also be less. So that's how advantageous homeopathy treatment is. Homeopathy treatment can improve your immunity. So sometimes what happens is, even after you take ART treatment, your CD4 count will not increase, but with homeopathic treatment you have high chance that it will increase. And also sometimes what happens with ART treatment is, even after you take ART treatment, your viral load is not coming down. Even in such cases you can take homeopathic treatment where it brings down your viral load. And also what happens is, you may have the symptoms of the ART treatment or side effects of the ART treatment. You can use homeopathy when you have high amount of side effects, or if you want to reduce the side effects of ART treatment, you can take homeopathic treatment as well. And also if you have the disease related symptoms, you have lot of symptoms coming up, you have other diseases like herpes simplex, or human papilloma virus, or hepatitis B. Even for such type of diseases, homeopathy is very effective. Finally, homeopathy is safe, homeopathy is effective, and homeopathy doesn't have any side effects, not even one side effect you can have with homeopathy. So homeopathy is timely. I recommend all of you to take the homeopathic treatment along with ART treatment. We are Fidicus Homeopathy. Fidicus Homeopathy has the highest success rate compared to any other homeopathic individual doctors or homeopathic corporate hospitals. We have the highest success rate for HIV. At Fidicus Homeopathy, we have the highest success, transparent treatment, and personal care. Thank you.